Thank you so much. Breaking news right now, our weekly Madison County update on COVID response. Let's listen in.
Mr. Chairman of the Madison County Emergency Medical Board, I'm sitting in for Jeff Birdwell today. It's Wednesday, March 24th. On behalf of the Mayor Tommy Battle, Mayor Paul Finley, Commissioner Dale Strong, Huntsville area government, healthcare, and emergency response agencies, we're bringing you this weekly briefing on our community response on COVID-19. Our speakers today will be Dr. Pam Hudson, CEO of Crestwood Medical Center, Devin Keith, Huntsville City Council District 1 council member. You will note that we are sitting at least 6 feet apart, abiding by the CDC guidelines. We're also practicing our own best practices to sanitize and to separate. I will begin with an update on the latest emergency management briefing with the Alabama Department of Public Health. We had 399,511 cases confirmed statewide. We have 8,266 deaths that are confirmed statewide. In Madison County, we have 28,950 cases that are confirmed and 378 deaths confirmed in Madison County. At this time, we will go ahead and get started. We would like to thank everybody for watching. We will be back next week, but I'll give further after the briefings. But right now we'll go ahead and start with Dr. Pam Hudson.
Thank you, Don. Good afternoon. It's a privilege to represent the healthcare teams in our community. We remain especially grateful for the difficult and demanding work that has been done over the last 1 year, and especially in the December to February time frame. The news here locally is good. Our hospitalizations for the county are at 32. That is one of the lowest since the summer. 2 in the ICU and only 1 on a ventilator. Across the region, the number total is 55 hospitalized, 10 in the ICU, and 8 on ventilators. Make no mistake, this is still a very serious disease for those who contract it and experience some of the more significant symptomatology. We are fortunate that we have a pretty low transmission rate right now. That is reflected by a test positive rate of about 5% and near zero in testing exclusively asymptomatic individuals. So good news there. And the vaccine supply does appear to be improving. So lots of reasons to be grateful. The reasons that we are where we are now are, again, going back to those public health measures and the compliance with masking, the social distancing, maintaining those 6 feet of distance, being outside whenever you can, sanitizing, curtailing travel. And again, you can't emphasize enough the being able to be outdoors when the weather is as nice as it is. The other factors that are making us have this lull, if you will, in our experience with the pandemic is that we have had an increasing number of citizens who are no longer susceptible or not susceptible at the moment. They either had the disease, you heard the 20-some-odd thousand folks that we know that tested positive and had confirmed cases, or they had an asymptomatic case, and we really don't have a good handle on what those numbers are, and the fact that we've been able to make some good inroads in vaccination, especially in those populations of high-risk individuals. For example, public health tells us that 66% of our at-risk population age 75 and up have received the vaccine in our community. So on the topic of vaccine, I am commonly asked, which one should I get? There are 3 vaccines, as you all know by now. There is the 2-dose Pfizer, the 2-dose Moderna, and the 1-dose J&J vaccine. So again, which one? They are all essentially equal in their ability to prevent hospitalization and death. And of course, those are the 2 things that we want to try to avoid people getting that sick. There's some slight differences in the effectiveness in it preventing all disease, but it does also appear that these vaccines reduce the risk of this asymptomatic illness where you're able to infect people around you, but you feel perfectly well. So the best vaccine is the one you can get in your arm as soon as possible. We are in a race, a very figurative and literal race, to vaccinate more people to prevent the next surge. The next question I get is, will we have another surge? And the answer is, well, this is a pandemic, and we can certainly expect it, but we do have opportunities to take some responsibility for how we can prevent, perhaps, another surge. And keeping in mind that we are barely out of the last surge. We still have patients that are hospitalized, that have been hospitalized for weeks as a result of the surges that we experienced in the December, January, February timeframe. So one of the other things that impacts whether or not there's a surge is, if you are listening to the news, you hear a lot of talk about the variants of the virus, and that some may be more infective than others. Listening to those reports can be very confusing, and so I wanted to share some terminology that will help you understand the news reports a little bit better. First of all, a variant is nothing more than the same old coronavirus that has experienced some mutations. The viruses mutate all the time. That's how they are successful and avoid the host being able to fight against them. There are 4 different kinds of variants with respect to the COVID virus right now. The first is a variant of no consequence. That means the mutations that are ongoing have nothing to do with how well the virus can be transmitted or how well it responds to medicines or whether it's impacted by the vaccine. So you won't hear likely about those in casual conversation. The next is a variant of interest. And those are variations or variants and mutations that have the ability to impact transmissibility, how susceptible they are to vaccine, and other types of treatments. Examples of these variants of interest are the 2 New York strains and Brazil. And from my listening to the news, I don't hear much about them. The reason is that they are variants of interest. The next level is a variant of concern. These are the ones that we're hearing about now. The UK variant, the 2 California variants, and also South African. These viruses have mutated, and they have the genetic markers that indicate with some evidence now, so there's some science behind the fact that the transmissibility is improved with these, or their resistance to the medications is a little bit more concerning, or has the potential to be more severe. But the difference here from the others that I mentioned is that there's some evidence that this is something we need to worry about. And the last, and the one that I hope we never hear about, is the variant of high consequence. And those are the ones that there is significant impact on the infectiveness or contagibility of the virus, and the transmissibility is much higher. There currently are no variants of high consequence known to science at this point in time. So I hope this helps. It's a little bit like your student coming home from school and a variant of no consequences. Instead of getting an A+ on a test, they got an A. A variance of interest might be your A+ student got a B. So that's of interest, but not anything to be alarmed at. And then the next step would be your A student comes home with a C. Now you're thinking this is maybe we're a little concerned, and then finally your A student comes home with a D or an F. That would be a variant of high consequence. So if you're trying to put that in kind of how you'd think about how much you need to worry. So we must continue with the things that we have worked for us. We need to continue with vaccination and keep working on that, and then masking, and that is a huge topic right now. On April 9th, the governor has suggested that she will remove the state mandate for masking, and that she's going to be putting the decision about masking in the hands of businesses and local authorities, and in the hands of citizens. Our local community will likely follow that lead and that guidance, unless our situation deteriorates. You know, the news today is excellent and improving every day, and so long as that continues, I think we would expect that our community leadership would follow, and we do have some indication from public health that that is what would happen here locally. So that would put the decision in the hands of business owners, citizens, and those decisions would be made much as we're making them now. Do you go into a crowded room of people that you don't know and are not wearing masks? Would you joyfully go into that gathering? Maybe not. Our business owners who have suffered so much from the impact of this pandemic, will they just one day say no more masking and run the risk of triggering what are we called in the past a super spreader event and result in us having to, the public health having to take more stringent steps? So I think you can also expect that regardless of the state unmasking, I guess if you say, or the reduction of the mandate, is that our local officials and public health, our hospitals, our public entities, cities and counties would likely continue that masking when they're face to face with the public. Again, everything dependent on the circumstances not changing. So those are our early indications now. I know that's a hot topic. Every day tells us more along that line. So I hope that you will stay safe, that you'll continue to mask, that you'll practice your social distancing and stay outdoors as much as you can. And I'll turn it back to you, Don.
Thank you, Dr. Hudson. This time we'll go to Councilman Keith.
Thank you, young man. And it is always a blessing, though. I wish it was on a different topic to sit with you, too. So thank you again for what you've done in the past year. I'm not one of these smart minds. I'm here to just ask questions, and I really want to bring questions from the community. And I'll just say before I ask those to everybody who's watching, as a small business owner, as a citizen of this great city, and as a leader on the city council, I will be encouraging and following mask ordinance until all of the opportunities for the vaccinations for every age group and every individual have come through. And I encourage you to make sure you're doing that in every establishment that you go in, every group that you're a part of, every church that you attend. Continue until all of the opportunities for vaccinations for everybody in every age group, in every situation, is available to wear a mask in this city if you care about this city. I just wanted to ask a couple questions, Doc. And again, Mr. Webster, I know you could jump in. You're a frontline worker as well as the doc. Questions have been asked about when a person gets a vaccination, first round, there's a waiting period. How should the interaction be, especially since it's been elderly individuals, between those who are supporting that elderly individual in that time frame to the second shot? And then conversely, after the second shot, what should interactions be with the elderly individual and the individuals who are taking care of that person?
Well, Councilman, that is an excellent question and one I hear a great deal. The vaccine is not considered to be fully protective until 2 weeks or 3 weeks after the second vaccination. So there should be no change in the precautions being taken in a household until that point.
And then after the second vaccination, how should the interactions be? Let's say an elderly individual who has consistent contact, who might have went to the swimming pool. I'm thinking of one person right now, consistently every Friday. Can that person now go without a mask, go and have interactions after that second vaccination?
You said it very well a few minutes ago. We would encourage everyone from a public health standpoint to continue to mask regardless of vaccination status. The CDC has relaxed its guidance on what we have in our own households. If everyone is vaccinated in the household, you can go without a mask. And that is some good guidance. For example, if your parents or grandparents are now vaccinated and everyone else in the household is vaccinated, you can be without a mask. But you can't tell the vaccination status of an individual by looking at them, and nor can you tell the infectivity if somebody is asymptomatic and has the virus. So it is best practice to wear the mask whenever you're out in public, unless you are with people that you know, or if you're at an outdoor or very large venue with the ability to social distance 6 to 10 feet.
Yes, ma'am. And then one last, which I don't have clarity on, but I said I would ask because I knew I was coming here. It might be some uncertainty around it, is the idea of blood type. And individuals now giving this plasma and giving blood, is there any clarity around who's encouraged to give it if you've had COVID? As there's a lot of, as I call, barbershop conversation about who should be giving it? Is it type O that nobody can get it? Is there clarity that you could give on that?
No, there's not. The short answer is that giving blood is something that we absolutely must continue to do for the safety and health of our community. So I would encourage everyone to give blood. It is my understanding that the blood banks have been doing an antibody test on blood donors so that they can prepare the convalescent serum. And the results on the convalescent serum are not quite as clear as they were earlier on, back in the late summer. I've not seen any recent articles on that, other than that the results, now that they have more scientific data, are not quite as strong as they were earlier, but I do know that it is being used in situations where patients aren't responding to other things.
Gotcha. Thank you, Ms. Webster, and thank you, Doug. I want to say again both to you. I know you don't probably hear it enough, but we thank God for your efforts here in the city of Huntsville.
Thank you, Councilman Keith. We appreciate you. Okay. Thank y'all for watching today. We will be back on next Wednesday, March 31st at noon with another briefing. That will be our last briefing, scheduled briefing, unless otherwise determined by our healthcare or our elected officials. Until then, critical updates will be posted on the City of Huntsville COVID-19's webpage and on the website for our partners, from our partners here today. Please stay safe, stay separate, and remember to sanitize. At this time, we will take questions. When you come to the mic, please identify yourself and what agency you're affiliated with. We will allow one question and one follow-up.
Good afternoon, Elizabeth Gentle, WFF 48. This question is for Dr. Hudson. Good afternoon to you. I'm curious how long people who were vaccinated in that very first round of vaccinations, how long is this vaccine good for them? Is there a point where they are going to have to, maybe down the road, get another vaccine? How long does the vaccine last in your system, especially if you're one of the ones in the first round? Is it like a flu shot where you're going to get it seasonal, or is there another time this year that people are going to have to go back and get another vaccine?
An excellent question, and the science does not support a recommendation in any direction at this point. This could end up being like influenza, that mutates just enough to keep the vaccine makers adjusting all the time. But we aren't going to know that. What we do know is that the immunity appears to be at least 3 or 4 months, which isn't particularly helpful because that's the only amount of time that the vaccine has been out. So I would say by the summer we'll have some better indication of that. But it wouldn't surprise me if we end up in a booster type situation with the coronavirus.
This summer is looking a lot different than last summer. We obviously have spring break. We have summer travel that people are looking at. Is there concern in the back of your mind now that we are back open again? People are going to spring break, summer travel. They're tired of COVID. They don't want to wear the mask come April 9th. They're going to lay it down. Is there fear on your part as a medical professional that we could start seeing some change in numbers?
Absolutely. I hope that people will continue to mask. I hope they will continue to use good judgment about the kinds of gatherings that they are doing. I think you're going to see continued interaction with people that are running businesses. An example is the airlines, for example. At some point, they're not going to want to be shut down again. So I think, and I'm hoping that people and business owners and citizens, as we move back into what formerly called our normal, that we will continue to be cautious about that. Yes, it's not just in the back of my mind, it's in the front of my mind. We have spring break coming up, we've got Easter, we've got graduations, all the weddings that have been put off for a year. We have the potential to be in other super spreader events like what triggered and contributed to the big surge that we had in December and January, and I hope that people will go back and look at the number of people in this county that died from COVID, the number of hospitalizations, the impact of this disease. It is not over. We appear to have made some progress, but it's hard to say whether the virus has just gone into hiding, and like the Terminator, I'll be back. So I hope we're ready. And when I said a race to vaccinate, that is absolutely imperative that we get vaccine in arms as quickly as possible. So if and when we have another surge, we have much fewer people that are vulnerable and much fewer people who could spread it asymptomatically.
Thank you.
Kelly Smith here with WHNT News 19. This first question I have, when we look at demographics of people who have been vaccinated, especially racial demographics, we see some huge disparities, especially right now among the Black community. This is for either Councilman Keith or Dr. Hudson or both. Is there any effort in our community here in Madison County to get vaccines directly into communities who need it? Are we looking at certain neighborhoods or different areas of Huntsville or Madison to actually bring vaccination clinics to people who might need it, especially when we look at, the Black community here?
Okay, we do know that there are various different agencies, as far as the hospitals have made efforts to go out to other locations in the different communities to make sure that there is people to, be able to do the vaccinations. Councilman Keith, Dr. Hudson.
So this has been a conversation about how to make sure that the most vulnerable, and our African American population is more vulnerable to serious illness and death, and so they are certainly at higher risk. We don't have enough vaccine in the community to be able to even comment on that. The discussions are ongoing, the networking and outreach, but without vaccine, it's very difficult. I know that the state of Alabama has had, in our lower population states, has had really good outreach, but those were areas where there wasn't a healthcare infrastructure, and so that was the outreach, was to go into those vulnerable populations. Communities like Huntsville, Huntsville Hospital has done a fantastic job of standing up that clinic, but you'll remember when their supply stopped, they had to stop. And we finally got a shipment of vaccine after not having any since January. So it does look like the supply is improving, and I think you will see this community stand up like we must to make sure we reach all the vulnerable population, and indeed everybody, because if we don't get everybody, we haven't protected the community.
And I'll answer it directly. When we talked about the issues of the social connotation around the vaccination, there was a lot of leery uncertainty. I even put a video out talking about the importance. I have not been vaccinated because it's not my term, but two of the issues that are coming up that you're talking about is we're going to have to talk about transportation and supportive services for the clients who would be there. So what you're having is, I use this correlation, we were talking about it about a month ago, the most individuals who ride public transportation in the city of Huntsville, the most routes are in 35810. That is the highest concentration of African Americans in the community. Well, if you go online, you have to set an appointment. You then are having an individual who's dependent upon transportation to get to the appointment. Well, a number of our vaccinations, like she spoke of, when you get down to Joe Davis Stadium, it's wrapped all the way down to Ditto's Landing. So there is an issue with having to have the logistical, chain sort of rerouted to have, when the vaccinations come, a segment of the population pre-considered. We have to be, and again, I'm not paid to be the Huntsville Hospital or go over the logistics. I'm not as smart or as intelligent as them, but they're going to have to segment how do we get vaccination, as you said, to a population and pre-select the population that we're getting it to so that we can cover them, because the logistical chain that it takes to get a number of people to the appointment and or to get the appointment set up or to get in line for a vaccination has become much like when this first happened with the testing. And until we get enough vaccinations that allows us to, what I believe should happen is pre-select, have an implementation process that is selective to those individuals, you will continue to see these disparities, because inevitably you have to consider a large amount of the people who are in the impoverished neighborhoods and those individuals who are now eligible are single individuals. They do not have a supportive service of a person who can absolutely drop everything, because COVID did not just affect health, COVID affected the economy. So people cannot drop everything, take a person and go get a shot, sit in line for a long time, take that person back, and then inevitably do it all over again for a second shot. So it's a great question, but it brings up a disparity of consideration. But the more vaccinations we get, I encourage Huntsville Hospital and other individuals who are giving out vaccinations to take that logistical point of pre-selecting groups that they will go and target because of the logistical headache that it causes.
One other resource that I wanted to bring up that was brought to our attention earlier is for people for transportation needs. 211, I think, is operated under the auspice of the United WAAY, and 211 is a resource that they can contact and make arrangements for transportation to and from.
All right, and my next question is, as we open up Phase 1C, I just saw an article that said, Alabama is in the top 10 states for vaccinating people, I believe it's 65 and over, but then we're kind of in the bottom when we look at the rest of the population. We've been looking at appointments as a news station all week, and for people who are in Phase 1C, it's weeks out for many people before they can get a vaccine. And I know we've kind of been talking about this, but just to reiterate, what is your message to people who are now eligible to get a vaccine but will not be able to get one until April or May or even later?
Thank you for asking that question. Sign up with as many places as you can. I know not all the vaccine entities will be happy to hear that, but it's important that you get a vaccine in your arm as soon as possible. If you do get a vaccine, then have the courtesy to call the other places you may have registered or expressed an interest to. But we know that the folks that have been persistent and have signed up in multiple places may have gotten the vaccine. So that's the first thing. The second thing is will you continue to do exactly what we've been doing right along? Masking, distancing. You just don't change that behavior at all, because you don't change the behavior after you get your vaccine either. Even with the CDC guidance changing, I'm aware of an office that everybody has been vaccinated in, and folks, when the CDC came out and said, well, you can, if everyone's vaccinated, you can, maintain the distance and you don't necessarily have to mask. They ended up continuing to mask anyway. There's just no reason for something that's simple, doesn't cost very much or anything, and doesn't hurt, has no side effects if you're able to wear a mask. And this has been very, very effective for us. So they just don't change anything and keep searching for the vaccine. I believe we will see more and more vaccine availability. So be patient and persistent, and y'all, the news media has done a great job of helping us to get the information out as soon as it's available. No one's holding on to vaccine in this community. Everyone is trying to get it out. There just hasn't been the supply yet. So we keep up the good work.
Thank you.
Okay, thank you.
Bridget Divers with WAAY 31 News. This question is for you, Dr. Pam Hudson. So we have a lot of severe weather coming in this week, and people will have to probably go to some storm shelters. How can they make sure that they're not going to get COVID at those storm shelters? And what would you say to them if they are concerned about that? Because would you rather be at home and in severe weather, or in a safe place where you could potentially get disease?
Since most of our, an excellent question, since we're have some suspicious weather coming in tomorrow, the advice is the same: mask, distance as best you can, and I feel pretty certain that since most of our shelters are run by volunteer agencies and public organizations, they have already taken this into account. A notable exception might be a family who has a tornado shelter, but again, if it's in your same family group, that would be of limited risk. So grab your mask and your hand sanitizer, and do the best you can with the distancing, and good luck to everybody, and hopefully the weather will pass us by.
All right, and so with, again, that severe weather coming in, is it potential that we could have some of our vaccine shipments delayed, or we might need to reschedule vaccine appointments depending on how it pans out?
Yes, and again, thank you all very much for helping when we do have to delay a day, and that's really what we're talking about. There is not a concern if you miss your date on the second dose by a day, one way or the other, actually multiple days. The CDC has come out with some recommendations on that, so it is not to the minute or the very day sensitive, and the vaccine agencies will put some information out if it's not safe for people to travel, and which we did in the snow. And just rest assured that that those vaccine doses, you'll either be added on to a clinic. You're not going to be put off for a month. You'll be put off a day, maybe, or 2 or 3 days at the most. Good question.
All right, thank you.
Okay, thank you. This concludes our briefing.
All right, that concludes another Madison County COVID update. It was led by Crestwood Medical Center CEO Dr. Pam Hudson. She says that we are in a race to vaccinate and that no vaccines are being held back right now. We're just waiting for more supply. Dr. Hudson says the good news is that hospitalizations are down. The COVID positive rate is down in Madison County, down about 5%, and the vaccine supply is improving, albeit we're still behind. Dr. Hudson does credit the low number of COVID positive rates to social distancing, sanitizing, masking, and curtailing travel, in her opinion. And in the meantime, she urges you to get the vaccine as soon as you're eligible. She did touch on the 4 forms of COVID variants right now, an interesting analogy she made using the school grading scale to describe each form. Now, as for continuing the mask mandate locally, after the state lifts the mask mandate after April 9th, it appears that everything is situationally dependent. Those discussions, though, are happening right now. Huntsville District 1 Councilmember Devin Keith asked some questions to Dr. Hudson that many people, quite frankly, are asking as well. He mentioned that he, as a small business owner and council member, will continue following the masking mandate until all opportunities for vaccines in each and every age group have happened. Dr. Hudson agrees with that. She says it's the best practice to continue to wear a mask unless you have the proper distancing of 6 to 10 feet. And one more thing that's worth noting right now, if you do need transportation to a vaccine appointment, you heard moments ago, call 211 to set that up. The next Madison County COVID briefing, by the way, comes your way next Wednesday at noon. It will, as you heard, be the last scheduled Madison County COVID response briefing. But before we